The most common headache diagnosis is migraine. You have common and classic migraines, but most headaches are muscle tension headaches. And that's the route to explore, certainly, if you have any type of headache. Terry Tanaka from the University of California tells us that if you can treat a muscle tension headache, it will decrease the severity and the occurrence of migraine headaches. And as people have come to understand the treatment of muscle tension headaches, the diagnosis between a migraine headache and a muscle tension headache are becoming closer and closer. TMJ is the name of the jaw joint. It's the most complex joint in the body. It's connected to the temple area, the mandible, and when used as a term or a condition, it's called temporomandibular joint dysfunction. You can have arthritis of the jaw joint. You can have a dislocation. You can have an inability to open your mouth. You can have facial pain, neck pain. Headaches are all associated with this. The challenge is to find out what system and what's causing the symptoms that you bring to the doctor. The most likely is to make an appliance that allows your jaw to move freely without any restriction and allows your jaw joint to settle back in the socket. Often your bite will cause the jaw joint to move out of the socket when you bring your teeth together, and this in turn can cause muscle pain. Whenever you want to find a doctor, a good way is to call specialists in your area. Ask them who they would recommend for the procedure that you're looking for. This is just a general rule. When you hear the same name once or twice, then go over the website and see what his qualifications are. This is not a problem that you just look at and say, well, we'll do this. First, you want the doctor to see how your jaw moves, listen to it with a stethoscope. Sometimes we'll even use a Doppler. A Doppler is the same thing they listen to babies' heartbeats with, and that determines movement and blood flow in the joint. You want to know if the muscles are sore. So you palpate or press different groups of muscles and see if they're tender. And if they're tender, they're likely causing pain. You need to look at the teeth if they have specific wear patterns that dictate that somebody grinds his teeth excessively. Often we'll even check people's posture because there's a strong relationship between the way you hold your head and the pain in your neck, which can radiate to your face and often be misinterpreted for jaw joint pain when you really have neck pain. Surgery is seldom involved in temporomandibular joint dysfunction. It is sometimes. But before you go to a surgeon, you need to have what we call conservative care. Rule out if it's primary muscle pain. I seldom refer to a surgeon, and if I do, I'm very selective about the surgeon I send my patients to. "90% of facial pain is muscle pain." Nelson Hindler from Johns Hopkins Hospital states that 90% of headaches are muscle tension headaches. So first, you want to treat the probable cause, which would be a muscle-related problem. If that fails, then there are blocks, anesthetic blocks, where you can inject Novocaine in the region of the jaw joint. And if that makes the pain disappear, then you have a firm feeling that it might be a primary jaw joint problem, and that would be need to send it to a surgeon for evaluation by him. One of the problems with temporomandibular joint treatment is in the hands of dentists. Dentists usually don't charge enough for their time unless they're doing something concrete. We're not used to the medical mode, where you go to a doctor, he examines you, diagnoses you, and talks to you. And you're used to paying a fair fee for that. When you go to a dentist for the treatment of pain or joint dysfunction, you need to expect a thorough evaluation, and it needs to be adequately funded so the dentist can afford to take the time to see you. An exam in my office will run between $200 to $300 for an hour of time. That is actually the same or less than I would make filling teeth. We have to do that to be able to provide this service. At the University of California Pain Clinic, 50% of the people seen there for all kinds of pain had the diagnosis of myofascial pain. Myofascial pain is pain of muscle and fascia. Now, by definition, myofascial pain has to come from the pain in your neck or your jaw. The average patient has been seen by 7 to 9 practitioners before they're referred to a dentist who's capable of treating the problem. And only a dentist can treat TMJ. You have to have a knowledge of occlusion, how your teeth come together. You have to be able to fabricate a needed appliance, if so. And you have to have a knowledge of head and neck anatomy and neurology to treat it well.